high blood pressure increases the risk of stroke, heart disease, kidney disease, and other health problems. Too much sodium worsens it, and most Americans consume more than recommended. As we age, and especially after menopause, salt sensitivity becomes more of a concern. What's happening at menopause that raises women's risk of hypertension and make them more likely to be salt sensitive?
So menopause is a change in a woman's life when she stops having her menstrual cycles or periods. And menopause is technically diagnosed when a woman has not had a period for 12 consecutive months. And what this really means is that that woman is no longer producing certain hormones, estradiol or estrogen and progesterone. So after the menopause transition, the production of these hormones goes way, way down, and we see that coincide with an increased risk of high blood pressure. The detriment of menopause to blood pressure risk is that these hormones are very vasoprotective, or they help the blood vessels to prevent high blood pressure. And we are trying to understand how these hormones actually lead to a protection from high blood pressure, and whether we can supplement these hormones or not to be able to prevent that high risk. And that is ongoing research right now.
Well, can you explain how that's tested and why it's difficult for someone's healthcare team to do?
So it's a very important point, and whether a person is salt sensitive is not traditionally measured in a routine clinical visit. So right now, in order to determine if a person has salt sensitive high blood pressure, a certain amount of salt is given and then blood pressure is monitored. So if a person eats a large amount of salt and their blood pressure goes up, or they eat very little salt and their blood pressure goes down, that person is then termed to have a salt sensitive high blood pressure. That means that the reduction in salt in the diet is most likely going to be able to help that person keep their blood pressure low. And it is estimated that up to 50% of people with high blood pressure actually have salt-sensitive high blood pressure. So it's really a good idea for all of us to kind of reduce the amount of sodium that we eat and prevent the likelihood that we might develop high blood pressure in response to dietary salt. Women really need to make sure that they are aware of their risks. Make sure that you are going to the physician regularly, that you are getting your blood pressure checked regularly. We are at greater risk than we are sometimes told, and we are less likely to see the doctor when we think that something like stress is causing our high blood pressure. You can reduce the salt in your diet, you can exercise, you can have other lifestyle interventions, and you also are entitled to treatment with therapies. So it's very important for women to take control of your health care, make sure that you are being heard.
This has been very enlightening. Dr. Faulkner, thank you so much for talking with us about high blood pressure in women, and thank you for being with us on House Calls.
Thank you so much for having me. I enjoyed the visit.